Medical Tourism Corporation interview with Dr. T. Sunder, cardiothoracic surgeon. Dr. Sunder has extensive experience in India and the United Kingdom.
I'm Dr. Sunder. I qualified in Stanley Medical College in '88 and then did post-graduation in general surgery. I was exposed to cardiac surgery here for a year, after which I went to England. I was trained there for 10 years. I was last a consultant in Southampton until 2002, after which I came here. Our training in England was a comprehensive training involving both cardiac and thoracic surgery, adult work mainly. So that is what we've been doing here. Now, having come here, Dr. Paul Ramesh was also trained in England. Both of us joined to form a group practice, and we offer the entire range of adult cardiothoracic services. So first we have to qualify to get the FRCS general surgery, which I got in 1996 in England, which is the FRCS England. And once you do that, you go into cardiothoracic training, and you need to be selected for a training post. And once you complete 4 years of training, you become eligible for the examination, which is FRCS Cardiothoracic. Now, once you do that, you get the exit exam, and then I got a consultancy post. Now, during this 4 years of training, we had a lot of conferences and workshops, the annual meet in England and Europe, also world congresses in America. As I told you, the entire adult heart and lung surgery. Heart, the commonest being coronary artery bypass grafting, which we did with the use of heart-lung machine and a beating heart surgery. And valve replacement, all the valves which needed replacing. And more importantly, what we call aneurysm surgery, where the big blood vessel is just ballooned out, becomes too big, where we got to do it. Of interest I have is surgery for what we call chronic thromboembolic pulmonary hypertension, which is not a very common operation being done. And the name of the operation is pulmonary thromboendarterectomy. The centers in the world are one in San Diego, and the other one is Papworth in England. I've spent time in both the centers, and I've got an interest, and we have done a couple of cases here in Apollo as well. And the second thing would be minimally invasive thoracic surgery, which is thoracoscopy. We brought minimally invasive thoracic surgery to Apollo hospitals here, and we've been doing it since 2004. All the procedures like pleural biopsies, lung biopsies, pericardial windows, all which used to need a big operation in the past, we do it just as a keyhole, a minimally invasive procedure. The common operations for which patients come across from abroad would be, one, as far as heart is concerned, the commonest is coronary artery bypass grafting. And that has been an operation which is the most common operation performed on planet Earth. It's got a good track record, and we've got an extremely good result with that. Now, heart valves, when the valve is diseased, either the valve leaks or it becomes big, it needs fixing. The best valve a heart can have is the natural valve. So if we can repair the valve, it's much superior to replacing it. Now, among the heart valves, I think the mitral valve is the only valve which lends itself to good repair, usually. So we do a fair amount of mitral valve repair surgeries. Well, sometimes we can't repair the valve. We go ahead and replace the valve. The entire spectrum of artificial valves are available here in Apollo, right from what we call a mechanical valve to tissue valves. All has been successfully implanted here. As regards the availability of instruments, the latest instruments, up-to-date instruments are all available here. The quality of the operation theaters are good. We have laminar flow, latest up-to-date equipments. World-class facilities are available, and the results here are at par with the international standards.
Medical Tourism Corporation facilitates affordable medical treatment at world-class international hospitals. Fill out the estimate request form on our site for a free quote and more information.